Dermatological conditions, bites, and stings. We can suffer bites and stings from mosquitoes, flies, spiders, ants, bees, fleas, and ticks. The signs and symptoms of bites and stings are typically painful and itchy spots. The management is often cold application and topical corticosteroids. It is important to remember that some of these bites and stings can be potentially life threatening, especially if we have an allergic reaction to venom. Anaphylaxis is characterized by contraction of smooth muscle and the dilation of capillaries because of the release of pharmacologically active substances such as histamine, bradykinin, and serotonin. This is an immediate shock like condition. It can be a fatal hypersensitive reaction. Anaphylaxis typically occurs within minutes of the administration of an allergen. We sometimes have an EpiPen autoinjector to treat anaphylaxis. This is a disposable epinephrine drug delivery system with a spring-activated needle. This is used to treat severe allergic reactions to insect bites or stings, food, drugs, and other allergens. EpiPens come in two strengths. An EpiPen Junior, which typically has a white label, is used for children up to 33 pounds, and an EpiPen Adult, which has a yellow label and can be used with anyone over 33 pounds. This is best when injected directly into the skin, preferably the thigh, but it can also be injected through clothing if necessary. Epinephrine constricts the blood vessels to improve blood circulation and blood pressure, and it relaxes smooth muscle to improve breathing. It also stimulates the heartbeat and reverses swelling and hives. The effects of epinephrine take place within seconds and can last for 10 to 20 minutes. The signs and symptoms of anaphylactic shock include respiratory distress, cyanosis, which is a bluing of the skin, lips, or fingertips, rapid and weak pulse, low blood pressure, localized urticaria or edema, paresthesia, dilated pupils, choking, wheezing, sudden collapse, headache, dizziness, seizure, and unconsciousness. To manage an anaphylactic condition, activate emergency medical services and treat the individual for shock. Use an EpiPen if you have one. Bees, wasps, and ants have a high menopterin venom. There is a risk of allergic and anaphylactic reactions in individuals. The signs and symptoms of bee, wasp, and ant bites include painful wheals or hives. The site rapidly becomes pruritic. Symptoms can extend beyond the site to include dyspnea or difficulty breathing, tachycardia, high heart rate, hypotension, and anaphylaxis. The management could result in a medical emergency, so it's important to watch people after they've been bitten. Spiders most commonly will produce a local reaction when bit by a spider. There is typically a painful lesion that may be pruritic, red, and swollen. There may be a systemic reaction as well. Individuals will likely suffer from restlessness, hypersalivation, dysphagia, which is that difficulty breathing, visual changes, roving eye movements, respiratory distress with stridor, which is a high-pitched wheeze or wheezing, hypertension, fever, loss of bowel or bladder continence, muscle spasm, and even paralysis. The management is to treat the symptoms and potentially transport the individual to the nearest medical facility. Ticks. Ticks are parasites that attach their heads onto people or animals and then absorb their blood. Rocky Mountain spotted fever and Lyme disease are two diseases that are carried by ticks. Signs and symptoms of Rocky Mountain spotted fever and Lyme disease include headache, low-grade fever, fatigue, and muscle pain. The management for any tick bite is immediate physician referral. Most of the time with Lyme disease, there is a characteristic bull's eye rash that appears 3 days to 1 month after infection and presents itself as multiple annular lesions of erythema with central clearing. To remove a tick, apply a substance that blocks the access to air. With the removal of the tick's access to air, the tick should withdraw their own head. Do not attempt to pull the tick off of the body. When you do this, the head can pull away from the body and the head remains buried in the skin. Scabies. Scabies is caused by a burrowing mite, which produces severe, intense itching lesions in the areas of its burrowing. This is contagious. The signs and symptoms of scabies include intense itching. Its affected areas appear as small, dark burrows and tiny vesicles. The symptoms could be within 24 hours or delayed by several weeks. The management is immediate physician referral. Individuals will often be prescribed a topical cream, but it is important to disinfect clothing and equipment, otherwise, this condition will reoccur. Lice. We have body, head, and genital lice. This is spread by close physical contact with another individual who is infected. It can take 10 days for the nit to hatch and then become an adult lice. The signs and symptoms are based on the location of the infestation. Patients may describe nighttime itching and thorough subsequent scratching, pustules, and even excoriation. The management for a lice infection is topical lotions and shampoos. It is important to disinfect clothing and equipment to prevent the spread of lice. Contact dermatitis. The signs and symptoms include erythema, pruritus, pain, and swelling. Allergic contact dermatitis occurs when substances come in direct contact with the skin. This is a simple inflammatory reaction. Common agents that contribute to the condition include adhesive tape, rubber articles such as straps, pads, swim goggles, swim fins, swim caps, and even shoes, tape adherent and remover, soap, detergent, and deodorant. Allergic dermatitis remains localized to the affected area and is identified by dry vesicles, accompanied by pain, erythema, and pruritic conditions. Heat, internal or external heat, intensifies symptoms and accelerates the skin's reaction. Irritant contact dermatitis. A substance causes direct skin damage. This only affects the area in the direct contact with the causative agent. This often occurs secondary to physical or mechanical agents such as dry ice burns, abrasion from artificial turf, poorly fitted equipment that causes friction burns, striae, bands of thin wrinkled skin, or increased sweating between the skin folds such as the groin or under breast tissue. It can also occur during skin loss secondary to an application of a causative agent such as adhesive tape. Causative agents should be identified and contact with the agent should be eliminated. Disqualification from activity is dependent upon the degree of skin involvement, severity of symptoms, and the specific sport, for example, contact versus non-contact sports. There is typically a sharp line of demarcation between normal and affected skin in irritant contact dermatitis. The management for contact dermatitis is frequently cold compress and topical and systemic antihistamines.